Well, the last time I did this was on the occasion of Roger's retirement party a couple years ago, and the same four of my classmates were here as are tonight, but nobody before us, and we felt pretty old. Well, it's nice tonight that we've got 3 or 4 who have been mentioned in classes prior to ours, so we're no longer the oldest guys around. Now, why I got asked to do the early years when they're all here, either they declined or I drew the short straw, I don't know. But here you go. And it's really a privilege because I treasure so much my years here and the people that I've met here over the years, in addition to my own classmates, and my constant association with people at Sloan over the years. And many of you are here tonight, so it's a real honor for me. About the history of Sloan, briefly. For those of you who receive Human Ecology's Link publication, you got a good refresher about President Malot's approach to Mr. Alfred P. Sloan in the early 50s regarding a possible donation to the engineering school, which was Malot's preference, only to learn that Alfred Sloan was really interested in improving the effectiveness of hospital management. Mr. Sloan was aware of the success and reputation of the hotel school here and envisioned a similar specialized approach to hospital administration. Soon, a study of existing hospital administrative education was commissioned by the Sloan Foundation, and as you all are aware, they were generally one-year academic programs then, followed by a residency. Among the conclusions were that any future hospital administration course of study should be 1 at the graduate level, should be 2 full academic years, and should preferably be in an urban setting such as New York City with its myriad of hospitals. Now, Alfred had a younger brother, Raymond, actually 18 years younger, who taught hospital administration at Columbia University at the time, had authored a number of books about hospitals and hospital governance, and this was thought by then President Malott to be a real advantage to Columbia. Now, Raymond was also for 20 years president of the Modern Hospital Corporation and editor of its publication. Whatever the reasons or combination of influences, Mr. Sloan decided to invest in an Institute of Hospital Administration at Cornell, and through President Malott's participation as a third prong of Cornell's Graduate School of Business and Public Administration. Hence, the program was founded in 1955, began in 1957 with the appointment of Fred LaRocca as the first director, which incidentally, the appointment was by a search committee of the Sloan Foundation, in that the business school took too long in doing it and there was some impatience, so LaRocca was appointed. And the first class, as was said, graduated in 1959. Now, from Fred LaRocca's perspective, Alfred bought an interest in modern hospital so that Raymond could advance his expertise in hospital governance and the role of the hospital trustee. In Doug Brown's memoir, it was thought that it was through Raymond that Alfred actually became interested in the need to improve the managerial effectiveness of hospitals. Incidentally, as one of the early classes whose residencies were entirely in New York City, we had the occasion to meet Raymond Sloan as he traditionally hosted the class at the end of the summer at his penthouse on the top of the Chrysler Building, which was quite a heady experience for us 20-somethings in the 60s. Sloan Institute in 1964. Many of us, upon arrival, looked forward to a career in hospitals, and after graduation, many of us did, in fact, start out in hospitals. I had come from 3 years in the Army Medical Corps, most of which was spent in operating rooms, and hence my experience in hospitals was all about teams of surgeons, nurses, and support staff taking care of patients, which resulted in my decision to pursue this career. Our first year was enjoyable, and we came together as a very tight-knit class and enjoyed the remainder of the founding faculty, some of whom have left, and the new director who had replaced LaRocca, who had left to run a hospital in California. We all went to New York City for our residencies. For Judy and I, at the New York Hospital Cornell Medical Center, the administrator welcomed us by stating that a good introduction to what he did was to review his mail. So every day we went through his mail and discussed some of what we thought were pertinent items with him. We were also assigned to a lab project, but I don't think we ever talked about patience that summer with the administrator. We returned to campus and learned that a new faculty member had arrived. His name was Roger. We were immediately told to revise our fall semester schedules, which we had, of course, chosen at the end of our first year, because his new courses were now required. Well, of course, we were second years, seniors, and it was the 60s, so naturally we protested. Of course, Roger prevailed. Our welcome of Roger that year may have seemed like freshman or rookie hazing to him, but out of profound respect, we did in fact invite him to our graduation party, appropriately for the times called a Bacchanalia, at Mike Wagner's place. Surely we served some pretty cheap wine, giving this new researcher a vision of a future challenge. So having welcomed him, provided him with trial by fire, allowing him to cut his teeth on our soon-to-be-known frailties, we think in light of his ultimate accomplishments extraordinaire, we have a small right to claim, and we'll share that with some of you, of course. Roger, we made you what you are.